and unpredictable biology where these principles are helpful. So these are the scenarios where these problems come in, like high-risk trauma, whether it is pelvis-tabular trauma or comminuted fractures, or salvage situations where there is a lot of bone loss, infections and non-unions, and also revisions and salvage surgeries. Why this mindset of oncology helps is because we do this day in, day out, reconstructing massive defects, whether it is soft tissue or bone, uncertain biology, distorted anatomy, high infection risk, like in tumor cases where we have high infection risk, we do this. And we need extensile approaches. What we do, because I always tell my fellows that if you want to expose a coccyx from front, we can do it in 15 minutes. So that's the command on the anatomy that we have, and these principles can be helpful in situations which are really messed up in some orthopedic conditions. As an orthopedic oncology, every day we train for neurovascular dissections and unconventional approaches and extensional approaches, flap covers, because we believe that because many of the times what happens is that we do resection and just the coverage of skin is not enough. We need to give good coverage, because good coverage is less infection. So we do a lot of flaps, and we do have a good insight about the flap coverage. And we don't, in situations where there is a need for radical debridement, we do use a lot of techniques like the bird and all. And we also have a fair idea about the mega process, which is like a back of our hand. And we can actually rebuild the anatomy, whether it is a soft tissue or bone, from the scratch. So, as an orthopedic oncologist, we are trained to reading our own X-rays, MRIs, PET scans, and angiograms, which help us in the diagnosis as well as treating these difficult situations in orthopedics too. So, as I've told, exposure is equal to treatment. It's just not the axis. If you are confident in exposing and keeping everything in front of us, then half the job is done. So many of the exposures which are generally orthopedic surgeons don't go in there, we become more confident in dealing with these exposures. So similar things, we handle the neurovascular bundle once we do the extensile exposures, and we deal with the bleeding and knowing exactly where is going to bleed. So we actually control those bleeding zones. And a few cases, like in this pelvic fracture, we have used the same principles, extensile approach, and preserving the vascularity, as well as controlling the bleeding, and ultimately a stable construct was given. This is one of the very first cases that I had done. So you can see a really lot of hardware there, and of late I don't use so much of hardware. So this is 9 years post-op. Similarly, another case of shattered sternum and pelvis. Similar principles applied, and that's the result. Another case, such bilateral pelvis, spinopelvic fixation. So similar kind of principles can be applied to infections, because we do radical tissue resection, like how we do it in the tumors. We stop all the dead tissue, and which is very helpful in dealing with infections. Zone-based debridement, we use high-speed bird, which definitely decreases the infection rates. And we also use antibiotic beads, which are osteointegrating antibiotic beads, which actually help in the lower recurrence rate in